Hi, my name is Joey and this is my NG insertion tube video. So to start off, I'm going to enter the patient's room. I'm going to perform hand hygiene. I'm going to introduce myself to the patient. Hi, my name is Joey. I'm going to be your student nurse today. Today we're going to be inserting an NG tube into you today. So what that's going to do is we're going to have a tube go down to your stomach. That way you can be fed without having to physically swallow anything. So with that, I'm going to ask you if you at any point throughout this procedure feel uncomfortable or need me to stop, please raise your hand and let me know. And I will ask you to start swallowing if you do have the feeling of coughing or gagging coming up, or as soon as I start inserting it, I'll ask you to swallow also. I will also provide privacy for the patient, which I've done so with the curtains. And now I will put the patient in high Fowler's position and get him ready for the procedure. Alright, so patient is now in high Fowler's. I put his call light next to him. I'm going to perform hand hygiene one more time. Put my clean gloves on. Clean gloves on. I'm going to prepare my tape really quick. Split one down the middle. Alright, now I'm going to assess the patient's nares, make sure those are good. Alright, those are clear, so they'll be good for the NG insertion. Next I'm going to grab my NG tube. I'm going to hold it in my hands for a little bit and warm it up, that way it makes it more flexible and the pliability is better for when I insert it. Alright, so I held on to it, I'm going to unwind it, and now I'm going to measure the tube to figure out how far down I need to insert the tube to get into the patient's stomach. So I'm going to start at the nose, go to the ear, and from the ear I'm going to measure down to roughly around the xiphoid process. In that area will be where the stomach will open up for me. So I'm around 59. So I'll mark that with my piece of tape that's not split. Right. And now, what I will do is I will use this loop here, spray it on this paper, and now I will lubricate the front end of the NG insertion tube, and I will begin to insert it to the patient. Again, warning the patient to let me know if he does feel comfortable at any point to raise his right hand, and I'm going to inform him to swallow, 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 swallow. And if he has any feeling of coughing or gagging, I'll have him take a drink of water to keep swallowing. And at this point I feel resistance in the patient, but I'm not going to tell him that. So once I feel that resistance, I will grab this piece of tape. I'm going to split it a little bit more. Put it on the nostril right here. Good, making sure I'm not obstructing the other nostril there with the tape. So now that I have secured the NG tube to the patient, I will test to make sure that it is in the stomach. So what I'll do is I will take my syringe here and I will put just a little bit of air into there, roughly around 15 milliliters. So I'll set that down really quick. I'll put my stethoscope on because I'm going to listen to the stomach and listen for air going into the stomach to make sure that it's in that area. So I've got my syringe with air. I'm going to kink the NG tube just to make sure if anything does come up, it stays in. I'll insert my syringe. Kind of switch hands here. Put my stethoscope on the stomach and insert the air. And I was able to hear air there, so that is a good sign. So next I will take the syringe off, or I'm sorry, I won't take the syringe out yet. Since the syringe is already in the NG tube, I'll pull it back a little bit and get some of the stomach contents out. Roughly around 20 to 30 milliliters is fine. Now I'll take the NG tube, kink it, grab the syringe, and pull that out. I'll set that on the table for now. And then I can then put the stopper back in. I'll just let that sit on the patient. Now what I'll do with the stomach contents is I will pour a little bit on some litmus paper and I'll test the pH of the residual fluid and make sure that it's acidic enough to be stomach content. And with the rest of the residual fluid in the syringe, I'll go ahead back to the NG tube. Make sure I kink it so no stomach content comes out. Insert it back and then just push all that residual fluid back into the patient's NG tube. I'll take the syringe out, put it back in, rest that there on the patient. I'm done with the syringe, and at this point I would make sure that the patient can get an x-ray as soon as possible to make sure once again that the NG tube is in the stomach. And after that I will make sure that the patient doesn't need anything else. At this point I can remove my gloves. With my gloves I will lay the patient laying back flat in the supine position. I'll raise this guardrail up to make sure he doesn't fall out of the bed. And also, if I had a safety pin, I would safety pin the NG tube to the patient's gown, but I don't, so I won't be able to do that in this video here. Alright, I'll put the call light next to the patient, make sure it's in reach, I'll perform hand hygiene, and then that will be the end of my NG video. And once again, my name's Joey, and that was my NG insertion tube video.